I worked for 17 years as a physical restraint nurse in psychiatric emergencies. 17 years holding people during the most violent moments of their lives. 17 years listening to screams, punches against the wall, threats. And in all those years, I saw something that nobody talks about, that nobody writes in the medical records, that no protocol explains. I saw the exact moment when the anger disappears. Not because of the medication. The medication hasn't even entered the vein yet. I saw this moment hundreds of times. And only now, after everything I've been through, do I understand what was happening. My name is Renata, I'm 43 years old, and for almost 2 decades I was the person who held the arm, who administered the injection, who stayed there until the body relaxed. I was trained for that. Protocol, technique, safety. But nobody trained me for what I was going to see in their eyes. Nobody prepared me for the words they said in the last seconds before falling asleep. And nobody, absolutely nobody, prepared me for the day when I myself would be lying on that stretcher, restrained, seeing what they saw. If you're feeling this way with me right now, stop everything, subscribe to the channel, turn on notifications, and leave a comment below about where you're listening from and what time it is there, because the next story will change everything forever. The first time I realized something different was happening was with a man in his 50s. It was the early morning, it must have been around 3:30 a.m., I remember because the clock on the wall of the restraint room had been stuck at that time for months and nobody changed the battery. The patient had come in screaming, breaking things, saying that everyone wanted to kill him. Acute psychotic crisis. The whole team was called. Me, 3 nursing technicians, and a resident physician. We followed protocol. We called him by name, tried to calm him down, offered him oral medication. Nothing. He lunged at the resident, tried to punch him. That's when we had to restrain him. 4 people holding him, each by a limb. I was holding his left arm. He was sweating profusely, his uniform was already soaked. He screamed non-stop. Get off me, you're going to kill me, I don't want to die here. His voice echoed throughout the entire corridor. The doctor prepared the medication, haloperidol and diazepam, a chemical restraint dose. We put him on the stretcher, fastened the bandages around his wrists and ankles. Safety protocol. He kept screaming, struggling. I held his arm firmly so the doctor could find the vein. And it was exactly at that moment, about 5 seconds before the needle went in, that I saw the change. His face, which was red, contorted, full of hatred, suddenly became soft. His eyes, which were wide open, fixed on the ceiling, changed. They became calm. He stopped screaming. He stopped struggling. And he looked at the corner of the room. Not at me. Not at the doctor. At the corner. And he said, very softly, almost in a whisper, "Mom?" I froze. The technician next to him also looked at the corner. There was no one there. The doctor administered the injection. The man continued looking at that corner. And he smiled. He really smiled, people. A slight, childlike smile. And he said, "I was scared, but you came." And he fainted. The medication took effect in less than a minute. We released the restraints, adjusted him on the stretcher, covered him with a sheet. Protocol followed. But I stood there, looking at that corner. I asked the technician, "Did you see anything?" He shook his head. Nothing. But he saw something. We left the room. I went to the break room, had a coffee, and wrote everything down in the chart. Patient physically restrained at 3:32 a.m. Chemical restraint successfully performed. Patient experienced sudden calm before medication administration. Reported visualization of a maternal figure. No incidents. I thought it was a hallucination. An effect of the seizure itself. But that smile wasn't from someone hallucinating. It was from someone seeing someone real. 2 days later, the patient was discharged. He remembered everything. I asked him carefully if he remembered what he had seen that night. He said, "I saw my mother." She died 8 years ago. But she was there. I know she was. And he started to cry. She told me I wasn't going to die. That it wasn't my time yet. That she only came to calm me down. He left the hospital different. Lighter. And I couldn't get it out of my head. Did he really see it? Was his mother there? Or was it just his brain creating a comforting image amidst the chaos? I didn't know. But it affected me. And I started paying attention. Every time we were restraining someone, I watched. I looked into their eyes. I looked where they were looking. And I realized it wasn't just him. There were more people seeing things. Many more. But I still had no idea what was to come. The second case that marked me was about 6 months later. A young woman, she must have been in her early 30s. She had been admitted in a manic episode, a bipolar crisis. She wouldn't stop talking, wouldn't stop pacing, saying she was the chosen one, that she had a mission. Her family dragged her in. Her husband was desperate. She hasn't slept for 4 days. She doesn't eat. She doesn't stop. I can't take it anymore. We tried to give her oral medication. She spat it out. She tried to escape. She attacked a technician. That's when restraint was indicated. This time I was in charge. Me and 3 other people. We held her down. She screamed, cried, said we were preventing her from fulfilling her mission. You don't understand, I need to go, he's waiting for me, I need to find him. The doctor prepared the medication. We put her on the stretcher. We fastened the restraints. She continued to struggle, but with less force. Her body was already exhausted. I held her arm for the doctor to administer the medication. And again. Again, folks. A few seconds before the needle went in, she stopped. She stopped screaming. She stopped crying. And she looked at the door. The door was closed. There was no one there. But she looked. And her face changed completely. From despair to peace. Real peace. She said, "Dad?" The doctor hesitated for a second. She looked at me. I signaled for her to continue. The injection went in. But the woman kept looking at the door. And she said, her voice choked with emotion, "I knew you wouldn't let me get lost." And she started to cry. But it wasn't a cry of despair. It was a cry of relief. "I saw you. I saw you. You were at the door. Just like I remember. With that blue shirt you liked." The medication started to take effect. She closed her eyes. But before falling asleep, she whispered, "Thank you for coming to get me." I was trembling. The doctor wrote everything down in the chart. But when we left the room, she told me, "Renata, I've seen this before. More than once. They see people. Always someone who's already dead." I asked, "Do you think it's real?" She shrugged. "I don't know. But they believe it is. And it calms them down faster than any medicine." The next day, I spoke with the woman. She was stable, medicated, lucid. I asked about her father. She started crying again. "My father died 2 years ago. Heart attack. He was my best friend. And I swear to you, nurse, I swear, he was there. I saw him. It wasn't a hallucination. I know the difference. I was in crisis, I know. But that was real. He came to calm me down. He always did that when I was a child and had nightmares. He would come into the room and say, 'Calm down, daughter, I'm here.' And that's exactly what he was saying there. I heard it. I heard his voice." She was discharged a week later. And she texted me months later saying she'd never had a crisis like that again. That now, when she felt she was about to break down, she remembered her father. And that calmed her down. And I kept thinking. Is it possible that these people, in their moments of greatest despair, can see something that we don't see? Does someone really come to get them? Or is it the brain creating a protective mechanism? I didn't have an answer. But I kept observing. Nothing prepared me for what I would see months later. The third case was the strangest up to that point. A 16-year-old boy. He had attempted suicide. He cut his wrists. His mother found him in the bathroom and called an ambulance. He was rescued in time. But when he arrived at the psychiatric emergency room, he was aggressive, violent. He said he wanted to die, that no one could stop him. That he had seen the other side and wanted to go back. The team tried to calm him down. They couldn't. He broke a chair. He tried to use a piece of wood as a weapon. The restraint was immediate. 5 people this time. He was strong, even injured. We managed to put him on the stretcher. I held his right arm. His wrist was all bandaged, with blood still leaking underneath. The doctor prepared the medication. And when we were about to administer it, the boy stopped screaming. And he looked up. Not at the ceiling. Right up, as if he were looking through the ceiling. And he said, in a calm, almost cheerful voice, "Grandpa?" I looked at his mother, who was at the door, crying. Her eyes widened. The boy continued, "Grandpa, did you come to get me again?" "Again, everyone." He said again. His mother rushed into the room. "My son, what are you seeing?" He looked at her, but he was smiling. "He's here, Mom." "Grandpa." He came again. Just like that time. The doctor gave him the injection. The boy kept looking up. He's saying it's not my time yet. That I have to stay. But when it is, he'll be waiting. And he fainted. His mother fell to the floor, crying. We had to call another team to help her. When the situation calmed down, I sat with the mother in the waiting room. I needed to understand. That time he said, "What was it?" She wiped away her tears. When he was 5 years old, he had a cardiac arrest. An appendectomy that went wrong. He was without a heartbeat for 3 minutes. When he came back, he said he had seen my husband's father, his grandfather, who had died before he was born. He described his grandfather perfectly. Clothes, way of speaking, even a gold watch he wore. My son had never seen a picture of that watch. It was stored away. And he described it. The doctors said it was a hallucination due to lack of oxygen. But I always knew it wasn't. She took my hand. "Nurse, my son saw him again today." I know he saw him. And this time, his grandfather told him to stay. He will stay. I know. And she was right. The boy was discharged 2 weeks later. He started therapy, he started medication. And 6 months later, his mother called me. "Renata, I wanted you to know. My son is well. He's alive. And he says he doesn't want to die anymore. Because now he knows that someone is waiting for him. And that when the time is right, it will be beautiful." I hung up the phone and cried. I cried a lot. Because I was starting to understand. These people weren't hallucinating. They were seeing. Really seeing. And whoever came to get them always brought the same message: calm down. It's not your time. Or, come, it's time. But always with love. Always with peace. And that changed everything. But I still didn't know what was coming next. The fourth case involved a child. And when it involves a child, you never forget. She was 9 years old. Nonverbal autistic. She had entered a severe self-harming crisis. She was banging her head against the wall, biting herself, scratching her own face. Her mother brought her in desperate. The girl had never been like that before. The whole team was called in. Restraint with a child is different. It's more delicate. We use less force, more care. But sometimes it's unavoidable. The girl was hurting herself. Blood on her forehead, on her arms. We had to restrain her. I held her legs. A technician held her arms. The doctor prepared a low dose of sedative. The girl was screaming, but they weren't words. They were sounds. High-pitched, desperate. Suddenly, she stopped. And looked to the side. At the empty chair in the corner of the room. And she made a gesture. With her hand. A gesture that the mother recognized immediately. The mother shouted, "She's making the grandma sign." The girl didn't speak, but she used some signs. And that sign, the mother explained later, was the one she used for her grandmother. The grandmother had died 3 months earlier. The girl continued looking at the chair. And for the first time in half an hour, she stopped screaming. She smiled. She smiled, people. An autistic child in crisis, restrained, hurt, and she smiled. The doctor administered the medication. The girl closed her eyes. But before, she made the sign again. And whispered something. The mother heard. I heard. It was the first word she had said in months. Grandma. The mother broke down. She fell to her knees on the floor. My mother came to get her. My mother came to calm her down. The girl fell asleep. When she woke up, hours later, she was calm. She didn't hurt herself anymore. The mother told me, days later, that the girl had started drawing. She always drew the same thing, a woman with white hair, holding hands with her. And a place full of light. The mother showed the drawings to the psychologist. The psychologist said it was the girl's way of processing the loss. But the mother disagreed. She's not processing it. She's showing what she saw. My mother went there. I know she did. And I knew it too. Because I had seen that child's face. And that wasn't imagination. It was recognition. It was love. And from that day on, the girl never had another crisis of that magnitude. As if her grandmother had left her in peace. And I thought, if even an autistic child, who lives in a world different from ours, can see it, then what else is happening that we don't notice? The 5th case was the one that shattered everything I thought I knew. It was a 60-year-old man. Alcohol withdrawal crisis. Delirium tremens. He was seeing animals, demons, shadows. He screamed that he was being attacked. The team restrained him. The usual protocol. But this time, when we held him, something happened that I had never seen before. He stopped screaming. He looked up. And said, "There are so many people here." We looked around. There was no one but us. But he continued, "There are a lot of people. Around you. Around me." And he started naming them. There's a woman in white. There's a man in a suit. There's a child. There's my brother. My brother who died on the motorcycle. He's here. The doctor administered the medication. But the man continued talking. They're saying I'm not going to die now. That I still have time. That I need to stop drinking. That they're going to help me. And he looked straight at me. With tears in his eyes. "Nurse, I'm seeing it. I know nobody believes me. But I'm seeing it. And they're real." He fainted. When he woke up, he asked for help. He entered a recovery program. And 6 months later, he returned to the hospital. Sober. To thank me. That day, I saw the other side. And I knew that if I continued, I was going to die. And it wasn't going to be pretty. But they gave me a chance. I saw it. And now I know. I was speechless. Because he was no longer in crisis when he told me this. He was lucid, clean, alive. And he swore he had seen it. And I believed him. Because at that point, I had already seen so many cases that I couldn't ignore it anymore. Something was happening. Something that medicine can't explain. something that no protocol covers. But it was real. As real as the ground I walked on. But none of that prepared me for the next case. The sixth case was witnessed by 7 people at the same time. Including me. It was an overnight shift. A 70-year-old man had been admitted in a psychotic episode due to advanced dementia. He was agitated, confused, and aggressive. His family had brought him in. The whole team was there, me, 2 technicians, a doctor, a resident, a social worker, and a security guard. 7 people. We tried to calm him down. It didn't work. He lunged at his son. We had to restrain him. We put him on the stretcher. And when the doctor was about to administer the medication, all the lights in the room flickered. All 7 people looked up. The lights flickered 3 times. And the man stopped shouting. And said calmly, "Maria, you've come." Maria was his wife. She had died 5 years earlier. His son, who was in the room, froze. "Dad, Mom's not here." But the man smiled. And looked to the corner of the room. And all of us, all 7 people, felt something. A shiver. A change in temperature. The air became lighter. And the man said, "I know, son. But she's here now. She came to calm me down. She always comes." The doctor administered the medication. The lights stopped flickering. The man fell asleep. And when we left the room, nobody said anything for about 5 minutes. Until the resident said, "Did you feel it?" Everyone said yes. The security guard, who didn't believe any of this, said, "I felt it. And I can't explain it." We went to check the electrical system. Everything was normal. No other light in the hospital had flickered. Only that room. And only at that moment. The patient's son came to me the next day. "Nurse, my mother used to do that. When my father got nervous, she would turn the light on and off in the room 3 times to get his attention. It was her way of saying, 'Calm down, love, I'm here.' Did you see the light flicker 3 times yesterday?" I said yes. He started to cry. Then she was there. My mother was there. And I couldn't deny it. Because I had felt it too. All 7 people had felt it. And none of us could explain it any other way. From that day on, I knew. I knew that when you hold someone in their moment of greatest despair, someone else also holds them. Someone you don't see. But who is there? And who calms them? Always calms them. And then came the day when I myself was restrained. I never imagined I would go through this. 17 years applying restraint. And suddenly, I was the patient. It was 2 years ago. I had just lost my sister. Car accident. She was my best friend. We worked together for years. And suddenly, she wasn't here anymore. I went into such a deep state of shock that I couldn't function. I stopped eating, sleeping, talking. My husband took me to the hospital. I was dissociated. Disconnected. I don't remember being aggressive. But they said I was. They said I started screaming, trying to get out, saying I needed to find my sister. That she was calling me. The staff restrained me. I remember parts of it. I remember being on the stretcher. I remember feeling the bandages on my wrists. I remember seeing the ceiling. And I remember feeling anger. A lot of anger. Because I wanted to go. I wanted to find her. And they weren't letting me. I remember screaming. And suddenly, I stopped. Because I saw. I saw my sister. She was beside the stretcher. On the left side. I saw her. It wasn't my imagination. It wasn't a hallucination. It was her. Just as I knew her. In her usual uniform. With her hair tied up the way she always wore it. And she was smiling. She put her hand on my arm. And said, "Calm down, Ree. It's not your time yet. I started to cry. But I want to go with you. She shook her head. You still have work here. You still need to help people. The way you helped me. And then she said something I'll never forget. Now you know. You know we don't disappear. You know we stay close. And when it's your time, I'll be waiting. Just like I always waited for you to get off your shift. I felt the injection go in. I felt my body relax. But before falling asleep, I held her hand. And she squeezed it back. I felt it. I swear I felt it. When I woke up, hours later, I was different. I wasn't desperate anymore. I was sad, yes. But I had peace. Because I knew. I didn't believe anymore. I knew. My sister was okay. She was somewhere. And she was going to wait for me. I talked to the team that treated me. They said I had suddenly calmed down. Before the medication took effect. And that I had said my sister's name. I told them what I saw. Some believed me. Others said it was stress, grief, the brain creating comfort. But I know what I saw. I know what I felt. And since that day, I work differently. I look at each patient I care for and I know they are not alone. That someone is there. Coming to calm them down, coming to get them, coming to say, calm down. Everything is all right. And I'm no longer afraid of death. Not at all. Because I saw it. I saw that on the other side there are people waiting. There is light. There is peace. There is love. And I know that when my time comes, my sister will be there. With that smile. Waiting for me to get off my shift. After that day, I went back to work. And everything changed. The protocol didn't change, the technique didn't change, the medication didn't change. But the way I look at each person I hold changed. I no longer see just a patient in crisis. I see someone who is being visited. Someone who, in the moment of greatest chaos, is receiving the most important visit of their life. And I understood that my job isn't just to administer the injection. My job is to hold them carefully. It's to look into their eyes. It's to witness. Because sometimes, I'm the only person there who believes what they're seeing. I talked to other professionals afterward. Nurses, doctors, technicians. Many had already seen the same thing. But nobody spoke up. Because they were afraid of not being taken seriously. They were afraid of seeming unscientific. But the truth is that science is beginning to study this. There are researchers like Dr. Bruce Grayson, who has dedicated his entire life to studying near-death experiences. There's the work of Dr. Pim van Lommel, who documented hundreds of cases of people who saw the other side and came back. There are studies on terminal lucidity, that phenomenon where people with advanced dementia, who haven't spoken or recognized anyone for years, suddenly become lucid hours before dying, say goodbye to their family with total clarity, and then pass away. Science doesn't have all the answers. But it's starting to ask. And I think that's important. Because if we ignore these experiences, we lose something fundamental. We lose the chance to understand that death is not the end. That there is something more. I don't know exactly what it is. I don't know if it's heaven, another dimension, energy, pure consciousness. I don't know. But I know it's real. I know because I've seen it. I've seen it hundreds of times. And I know because I've lived it. And now, when I see a patient looking to the corner of the room, smiling, calling someone by name, I no longer doubt. I believe. I hold their hand. I say, it's okay. They've come to get you. And sometimes, they look at me with relief. It's as if they were waiting for someone to confirm it. As if they needed permission to believe what they were seeing. And I give them that permission. Because if there's one thing these 17 years have taught me, it's that in moments of greatest vulnerability, in moments when we lose control, in moments when we're being held against our will, we're also being held with love. By someone we don't see. But who is there? Always has been. And always will be. I lost my fear. I lost my fear of dying. I lost my fear of holding someone who is dying. Because now I know it's not the end. It's just a passage. And on the other side, there are people waiting. There is light. There is peace. And there is love. Always love. If you are reading this now and have lost someone, I want you to know, they are okay. They are somewhere. And they are waiting for you. Not in a hurry. But with love. And when your time comes, they will be there. Just like my sister was for me. Just like that man's mother was for him. Just like that boy's grandfather was to him. They are waiting. And it will be beautiful. I saw it. And now I know.